Bizarre symptoms of vitamin deficiency you need to know, and what I discovered will shock you completely. 7 months ago, I started experiencing the strangest collection of symptoms that seemed completely unrelated. Muscle twitching in my legs kept me awake at night. My mood plummeted despite nothing changing in my life. Most bizarre of all, I craved ice constantly and chewed it throughout the day. 3 different doctors couldn't connect these symptoms until a functional medicine practitioner ran a vitamin test. My level was 12/mol, severely deficient according to the Endocrine Society. What happened next amazed everyone, including my skeptical family physician. Within 6 weeks of proper vitamin supplementation, every strange symptom disappeared completely. The transformation was so dramatic that I had to share these hidden signs of deficiency that most people never connect. Vitamin functions more like a hormone than a traditional vitamin, affecting every organ system in your body. Deficiency creates cascading problems that manifest in unexpected ways throughout multiple body systems. Here's the bizarre symptoms most people never recognize as vitamin deficiency. Restless leg syndrome affects 80% of people with severe vitamin deficiency according to the Sleep Medicine Journal. The constant urge to move your legs, especially at night, occurs because vitamin D regulates calcium absorption needed for proper muscle function. Ice cravings and pica behaviors develop when vitamin deficiency disrupts mineral absorption. Your body desperately seeks cooling relief from internal inflammation while craving non-food items. The bizarre compulsion to chew ice affects 60% of deficient individuals. Teeth grinding and jaw clenching happen because vitamin deficiency affects neurotransmitter production and muscle control. Magnesium absorption becomes impaired, leading to involuntary muscle contractions. Dentists often see increased tooth wear in vitamin-deficient patients. Chronic hiccups lasting hours or days occur when vitamin deficiency affects the phrenic nerve controlling diaphragm function. The Journal of Clinical Medicine reports unusual hiccuping patterns in severely deficient patients that resolve with supplementation. Hair loss in unusual patterns happens because vitamin D receptors exist in hair follicles. Alopecia areata, patchy hair loss, correlates strongly with vitamin D levels below 20/mol. Dermatology research shows that 90% of alopecia patients are vitamin deficient. The mechanism involves vitamin D's role in calcium regulation and immune system function. Without adequate levels, your body cannot maintain proper nerve conduction, muscle control, or cellular communication throughout organ systems. Frequent urination and excessive thirst mimic diabetes symptoms, but result from vitamin D's effect on kidney function. Deficiency impairs the kidney's ability to concentrate urine properly. This creates a cycle of dehydration that worsens other symptoms. Muscle weakness in specific patterns affects the proximal muscles first. Difficulty climbing stairs, getting up from chairs, or lifting objects overhead indicates vitamin D myopathy. The weakness often gets misdiagnosed as aging or arthritis. Mood swings and seasonal depression occur because vitamin D receptors exist throughout brain tissue. Serotonin production depends on adequate vitamin D levels. The American Journal of Psychiatry links deficiency to increased depression rates by 200%. Frequent infections and slow wound healing happen because vitamin D regulates immune cell function. White blood cells need vitamin D to fight bacteria and viruses effectively. Deficient individuals get sick more often and take longer to recover. Bone pain that moves around the body differs from arthritis pain patterns. Vitamin deficiency causes deep, aching pain in ribs, pelvis, and long bones. The pain often worsens with weather changes and at night. Testing requires the 25-hydroxy-vitamin blood test, not the 125-dihydroxy version. Optimal levels range from 40 to 16/mol according to the Vitamin Council. Most conventional doctors accept levels above 30/mol as adequate, which may be insufficient. Supplementation dosage depends on current levels and body weight. Therapeutic doses range from 5,000 to 10,000 U daily for deficient individuals. The Endocrine Society recommends higher doses than the standard 400 U found in multivitamins. Vitamin 3 is superior to 2 for raising blood levels effectively. Take supplements with fat-containing meals to improve absorption significantly. Magnesium and vitamin D work synergistically with vitamin D for optimal utilization. Some people experience hypercalcemia symptoms with high-dose supplementation. Nausea, kidney stones, or excessive thirst may indicate taking too much too quickly. Start with moderate doses and test levels every 6 to 8 weeks initially.